The union representing caseworkers with the Department of Health and Human Services in our state says it needs more staff. 13 on your side's Lauren Baker spoke to a union rep earlier. And Lauren, what's that union saying about this shortage?
Juliet, the UAW Local 6000 recording secretary says it will take thousands of workers to fix the problem all over the state and right here in Kent County.
When do we need it? Now! What do we need? More staff! When do we need it? We need more staff, and we need more staff now.
UAW Local 6000 recording secretary Ray Holman says his union represents caseworkers from the Department of Health and Human Services in the state, and it's seeing a shortage in workers, training, and resources.
We don't have enough bodies, number one. We don't have sufficient training. Our caseworkers are not given the tools to be successful.
Tools he says caseworkers need as they investigate difficult cases that involve things like child and elder abuse. And because the department is understaffed, he says it's causing people to not only get burnt out,
What do we want?
More staff!
When do we want it?
Now!
but also leave.
We have so many vacancies. We have so many people leaving state service early because they're so stressed out.
Wednesday was the union's fourth informational picket since September, and it says it plans to continue to picket until department leaders begin to make changes and hire more people. Because Holman says if cases continue to build on top of social workers' desks, the issues will only get worse by the day.
These caseworkers have the ultimate responsibility of maintaining the social safety network here in Michigan. And you're talking about food security. You're talking about child abuse. You're talking about the most basic services that's required to keep the state healthy and running.
And we reached out to the Michigan Department of Health and Human Services about the union's issues, and they said in their statement, in part, we value the contribution of every Michigan Department of Health and Human Services team member to deliver much needed assistance to Michigan families. The department has been successful in hiring more staff recently, thanks to their competitive compensation, which will help ease workload and ensure caseworkers can give their undivided attention to Michiganders who need help. Juliet, back to you.
Lauren, thank you.